Let's explore 6 reasons why I recommend working with a board-certified obesity medicine physician. My name is Dr. Lindsay Ogle, and I'm board-certified in obesity medicine and family medicine. And let me take some time to explain that. So the process to becoming a board-certified physician is long and a little bit complicated, and everyone's path is a little bit different. I'm going to go over my path to explain it a little bit better. I went to undergrad at Indiana University in Bloomington, and so all physicians have to have an undergrad degree. You can actually choose what major you want, but you do have to have some core science classes that are required for each medical school. I actually chose nutrition science because I was always interested in nutrition and I wanted to learn some information that I could apply to my own life, but also my future patients' lives. And it aligned with a lot of the pre-med classes. So I have my undergrad in nutrition science. And then after undergrad, or sometimes during undergrad, you take the MCAT, which is a test, an entrance test to medical school. So based on your undergrad and MCAT, then you apply to medical school. They will accept you, hopefully, and then you have 4 years of medical school. The first 2 years for most medical schools are in the classroom, learning basic science, and then the last 2 years you are really shadowing and helping physicians and residents in medical settings, although you are not directly making decisions. You are kind of in a truly kind of like an internship and learning clinical medicine that way. And you're deciding what specialty you want to go into. And after you decide what specialty you want to go into, then you apply to additional training program, which we call residency. And I chose family medicine because I wanted to focus on prevention and helping patients achieve and maintain their health. And family medicine residency is 3 years. 3 years is the shortest duration of any residency program. So pediatrics, family medicine, internal medicine, some emergency medicine programs are 3 years. And I think I'm mentioning all the ones that are 3 years. And then all the other programs are anywhere from 4 to 7 years, depending. And then some people after that go on to additional training and complete fellowship programs, which are further subspecialized. And those can be anywhere from 1 to 3 years. And so that's like a general overview. But my residency program, that was in Colorado, and during family medicine residency, that's where I was introduced to obesity medicine, and I started studying for that. As of right now, obesity medicine is something that you can get your board certification in without doing a dedicated fellowship. There are fellowships out there, but not very many. Most people do training on their own, go to conferences, and then sit for that board certification after they have their primary board certification. So as you can see, that is there's a lot of steps there, and it's a little bit complicated. And overall, if you count undergrad, then my training was technically 11 years without including the obesity medicine training that I did on the side in addition to becoming a family medicine physician. I say all of that to highlight the importance of finding the right person who is going to support you in this journey. And I'm partial to working with physicians, but I do realize that I'm biased because I am a physician, but there are wonderful, amazing physician assistants, although I think they go by physician associates now, and nurse practitioners, and other healthcare providers out there that you can absolutely work with. And I encourage if that is what is right for you. But the point of this is to highlight the difference between an obesity medicine physician and other physicians. And I'm saying this as a board certified family medicine physician, and I practice primary care for several years in the Kansas City area. And I loved that opportunity to be a primary care physician. But there were a lot of limitations to that job. I was able to promote the fact that I was also board certified in obesity medicine. So many people came to me specifically for weight management, but I was limited in the amount of time that I was able to see those patients. And honestly, there were so many other things that I was focused on during the day with my other patients and their other concerns and having a large patient panel that I was not able to provide the most comprehensive care that I can now that I am able to focus on obesity medicine. So thank you for listening to that overview and my path here to practicing as a obesity medicine physician in private practice. But I do want to highlight those 6 reasons why I recommend you do consider an obesity medicine physician. The first is that by default, we are very compassionate people. Obesity medicine physicians have gone out of their way to practice in a specialty that focuses on treating patients who have been marginalized and have had to overcome many biases in their personal life and within the medical system. And we have specifically been trained on how to combat our own biases and how to approach patients with compassion. And so every obesity medicine physician that I have met is extremely compassionate, trustworthy, open, great listeners. And I think we are just great in our field. And so if you have had medical trauma, seeking care when you are living in a larger body, then I am confident that working with an obesity medicine physician will be a different experience. So that is reason number 1 to seek a board certified obesity medicine physician. Number 2 is that studies show that patients who work with a board certified obesity physician are more likely to tolerate their GLP-1 medication and therefore maintain it long term. They're more likely to stay in treatment on their GLP-1 medication. And this is for a couple of reasons. One, we have more training on how to utilize GLP-1 medications. We understand how they work and how to mitigate side effects better. We also have a lot more understanding of the nuance of titrating the medications rather than somebody who does not have that training and is more likely to follow a set titration schedule and are not individualizing the medication to that patient. We also are more likely to stay up to date on recommendations for GLP-1 medications, as well as the newer medications that are coming out, which are very exciting. So especially if you've struggled on a GLP-1 medication before, you might not have had the correct guidance that an obesity medicine physician would be able to provide you. Reason number 3, and this is something that I've seen fairly often, is that patients don't realize that they may actually have coverage for their GLP-1. I've seen this in a couple of ways. I've had a few patients who have been paying out of pocket for their GLP-1 medication, whether that's brand name or compounded versions of the medication, and then they see me and I have a better understanding of how to bill and code for that medication and how to complete a prior authorization and get coverage for them. I've also had patients who were told specifically from another doctor that their insurance does not cover the medication, when in fact it does. And that could be just a lack of understanding of coverage or the different qualifications to even attempt coverage. So again, I have been able to see patients save hundreds of dollars by seeing me rather than another doctor. I also have an up-to-date understanding of the direct-to-consumer options for brand name GLP-1 medications. That's also something that's changing rapidly. And so utilizing those methods will also help people save money compared to certain compounded versions or using coupons at the pharmacy. There are many options, and I discuss those in detail with my patients. Number 4, although we are obesity medicine physicians, we don't necessarily always like to focus on weight. We are always bringing treatment back to health-related outcomes. And so if you are somebody who is wanting to improve your health and improve your well-being and how you feel on a day-to-day basis, I recommend working with an obesity medicine physician because that is our goal. Our goal is not to bring everybody to a quote unquote normal weight or normal BMI. We understand that weight and BMI have flaws. They don't tell us the whole picture, and that you can be healthy at various sizes. Our goal is to treat the underlying condition. It goes back to why I went into family medicine to begin with, to help with prevention and to help patients achieve and maintain their health. And I believe that obesity medicine is the way to do that for many, many people, because by treating the adipose tissue dysfunction, the insulin resistance, increased inflammation, just the true weight that causes joint disease and arthritis and obstructive sleep apnea and difficulty breathing and fatigue, we are treating all of those related complications by treating the excess adiposity, the excess weight. And so it helps to get to the underlying cause. And again, we're keeping a health focus, and I will always remind my patients of all of the ways that they are improving their health along this journey. So even though our specialty is called obesity medicine, we truly don't care as much about weight as we do about health. And alongside that, we have the 4 pillars of obesity medicine. So we're always going to be thinking about these pillars. There is treatment, which is medication and or surgery, nutrition, physical activity, and behavior change, which includes sleep and mental health as well. So we are thinking about these things constantly for our patients. And so you're getting a very well-rounded approach to your health with your one physician. And we refer out when needed. We refer to dietitians, therapists, physical therapists, trainers, specialists in other fields like sleep medicine, endocrinology, OBGYN, neurology, cardiology, nephrology. We work on in a lot of ways like primary care and being kind of like the team lead, but we do have this focus of obesity care. And last, most obesity medicines are in private practice or have a clinic set up where they can see patients for longer periods of time and more frequently. As I mentioned before, when I was practicing primary care, I was definitely seeing patients for obesity care, but I was not able to see them as frequently or for as long as I can now in my primary practice or my private practice, Missouri Metabolic Health. In this practice, I see new patients for an hour, and we have a comprehensive intake going over their whole medical history, family history, weight history, what they've tried before, what's worked, what hasn't, what their life looks like right now, their job, their family, who do you live with, nutrition, physical activity, sleep, mental health. We talk about their current insurance and what their thoughts are about treatment options. Do we want to focus on lifestyle alone? Do we want to include medication? Should we refer to other health professionals? And we come up with a comprehensive plan at the end. Follow-up visits are always a half an hour, so we can touch on our plan and touch on all those components. And then we follow up typically monthly, sometimes even sooner. And sometimes once things are settled, we can space it out a little bit. And I have a smaller patient panel, so my patients can message me and I can get back to them fairly quickly. And so we have a very close relationship. And many obesity medicine physicians have a similar practice. And so if you are looking for health-focused, compassionate, evidence-based, comprehensive care, then I recommend looking for a board-certified obesity medicine physician. If you are in Missouri, you can see me at Missouri Metabolic Health. If you have any questions, you can go to the contact page and send a message and we'll get back to you as soon as possible. If you are not in Missouri, then I will include a link so you can find a board-certified obesity specialist in your state. But as always, share this with somebody who would benefit from the information, and I will catch you next week and we will go over a new obesity and metabolic health topic. Take care.